Hello everybody, my name is Casey, and this semester I read The Hot Zone by Richard Preston. So The Hot Zone is about the infectious disease Ebola and how it made its way into Reston, Virginia. So Ebola has often been associated with African countries, and this is because Ebola has had a significant impact on Africa, especially the 2014-2016 outbreak in West Africa, which was the largest Ebola outbreak to date. A lot has been learned about the spread of this disease. There are certain funeral traditions some Africans hold that involve touching, kissing, and washing the deceased body. Ebola is transmitted through bodily fluids, so if the deceased person were to be infected with Ebola, these traditions could easily transmit that disease. It is important to note that the stories in this book took place before the 2014-2016 outbreak. The events took place sometime in the 1980s. So how did Ebola reach Reston, Virginia? So this city ran a quarantine center for monkeys. Each year, thousands of wild monkeys are imported to labs in the U.S. for research. But before they can be shipped to those labs, they must be quarantined first for about a month to prevent the spread of infection and diseases. So while in this quarantine, an unusual amount of monkeys began to die. So the veterinarians sent samples to a lab, and they found a rope-like virus under the microscope, which they later determined was Ebola. So because of this, the Army Medical Research Institute decided to euthanize all of the monkeys in the room with the infected monkeys. So during this process of euthanizing the monkeys, there were a few who were exposed to the Ebola virus, including the scientist who discovered the samples containing Ebola. When the scientist received the samples, he didn't know what was in them. He thought it might be some type of bacteria, so he wafted the flask, kind of smelled it, because apparently bacteria usually has a smell, and by doing that, he unknowingly exposed himself to the Ebola virus. However, nobody who was exposed to the Ebola virus became ill. So this is when they discovered that this was a new strain of Ebola that is now called Ebola Reston. So a small mutation in the virus's genetic coding made it harmless to humans, but still very deadly to monkeys. This is opposed to Ebola Zaire, which kills 90% of people infected with it and is very deadly to humans. So before I chose this book, I had no idea what our country and the whole world would be going through with COVID-19, but I am happy that I picked this book because it is also about an infectious disease, and I think it has some really important things to take away. So this book did a really good job of expressing how important containing the spread of deadly infectious diseases is and how easy an exposure can happen. When those working with the monkeys entered the room, they had to wear space suits, 3 pairs of gloves, the room was airlocked, and there was a chemical shower after you left. So the workers did everything they could to ensure that the disease stayed in that containment center. And I think we have all seen with COVID-19 what can happen if proper precautions are not taken. Things get out of hand really fast, and exposure can happen a lot easier than we think. Another important connection that I made between this book and COVID-19 is the mutation of viruses. So just a small change in the genetic makeup of this virus made a strain that was harmless to humans. However, this strain of coronavirus, COVID-19, is very harmful to humans because it is the strain we have not been exposed to yet. So we do not have any immunity to COVID-19. So those who might compare COVID-19 to the flu or common cold need to keep this in mind and realize that this makes it a much larger danger to people. And who's to say that the virus could mutate into something even stronger? You know, those working with Ebola in Reston, Virginia probably didn't anticipate that they would discover a strain that was harmless to humans. So overall, I think this book is excellent for those in public health, especially those interested in infectious disease. But as we have seen, infectious disease can affect us all profoundly. So the more we understand about prevention and emergency preparedness, the better we are equipped to handle a situation like this in the future.